Hi everyone. I'm creating this video to one of my family friend who is a dentist, and this is a business model which is derived from a subscription business model. And I'm not a medical profession, so I'm not sharing how to package it, but what is the idea, how it is working currently in US, and how internationally this is getting accepted by the clients or the customers. Uh, what it is called is as uh, concierge medicine. Sorry, I'm not able to pronounce it, but the idea here is that you either get a same day appointment with the doctor or at max the next day, and you can do a last minute scheduling. There's no hassle. You can talk with the doctor. Sometimes you even get the doctor's phone numbers. Okay, a different name to it. There is also called as boutique medicine, retainer based medicine, platinum practice, direct primary care. It's membership based healthcare basically. So the idea is you give a flat fee monthly to get unlimited access to office and telehealth uh, health visit as well. So you can keep it as on uh, instead of telehealth, it could be an email health kind of a thing. If you think that it will be abused or something uh, by the clients or the customers, but it depends upon how you start. So I have a simple idea that on top of this framework that you can try and test it out. Let me share some of the pricing. Okay. So in this article, it was mentioned that per month they pay a flat fee of $60 here, and it can be a family fee is also there, membership or up to $200 a month. Let's go to some pros and cons. So guarantee access to 24/7. So basically, the 24/7, the idea is you can have access. The reply can be on the next day or sometime on emergency on the same day also. The standard care, wound treatment, blood work, and this is for a general physician. But the idea I had is for the dentist, and I'm not sure what this copay and all this, but yeah, but the common medicine that is available at the dispensary is offered. Con is that it is not. You still need your regular health insurance, and sometimes it is not covered by the insurance. The fee increases as your age increases, and it can be an expensive services. Okay, but yeah, convenience over the spending. Again, the pricing is been given. I will mention the link article to this link. Okay. So here is one of the checklists that they have given. Can I afford a monthly fee on top of my insurance? How important is access? Do I have a chronic condition to require a specialist? Okay. Now, for dentist, it could be a different reason or the different pain that you could have. Now, the idea that I have, let me just take it to the top. Yeah, the idea that I have here is this won't be for the entire uh, customer or patient. Sorry, I'm calling them customer. It won't be for the entire patients, but there could be a set segment of your patient who might appreciate this. And uh, what I was kind of having or thinking was that uh, you can start by blocking up 2 hours of your day for this services. So every day 2 hours you block it for this services, and because the promise is you get a same day appointment, not exactly which time. So you have a regular appointment, whichever block you keep on. You don't full your block. You keep a empty block for 2 hours to address these clients who are in this membership services, and what they get is access to you, and this blocking time. And post on top of it, you can give an yearly free cleanup, which is, I got some chart here. So maybe the most low cost thing that you can do a cleanup, maybe not even an X-ray, but a simple cleanup for one person. So if it's a family package of $200, that would be that, and a month, one once a year cleanup, which is anyways required, so that gets covered. So what you're trying to do is, on top of like, so they don't, you don't charge them visiting fee, but if they don't come, you get, they have to pay you because you're blocking their time for emergency. So that is one thing that they get secured themselves. Secondly, now if you think like, but why will someone uh, take this? I did some thinking about it, and let's say you only have 12 clients, okay? Well, let's do a simple calculation. So 200 pounds of family. So you do it as a family package to begin with, and not as an individual, to have enough money so that you have some of your bases covered. Okay, so if you have only 12 clients, that's $2,400 into 12 months. That's roughly 28,800. So that would be your yearly income only of this. So you're not giving anything extra out of it. Now, a family of four or a family of five can decide how much you want to give that. But one niche that I could have think of is uh, the family who are influencers. So those people who are influencers and continuously create videos, or those have maximum screen time, they need a regular checkup, or they need some kind of provision for them to take care of their dental care. And their schedules are off the charts normally, so they might not be sure like when would be the next appointment. So if their shoot gets cancelled, or if they have a busy month or something, and one month it's free, they can quickly come and uh, have an appointment with you. And post which, if there are any other services, they will pay for it. So there's no special discount or anything on them. Only thing is that they get access to you via phone or chat, that depends upon you, and they have this services. Now, there could be an argument saying that, okay, if you block 2 hours each day, that doesn't even cover the basic cost of my yearly income that I could make by giving an appointment to the patient. Okay, that argument I kind of agree. I don't think like the 30K will suffice to it, more or less, because uh, that will keep these people. So firstly, that covers a little bit of income, and then one of the membership people, when they visit it, they will pay for some of the services. So it's not complete zero income on that side. But again, we will have time when you don't have patients to attend, and you will have to keep that empty, because suddenly if someone comes, then, and if you have that opportunity, that's a delight moment for the patient. But during that time, you have to kind of work on different ways to deliver uh, services to the client. One of them is known as productized services, which I'm pretty much a fan of it, which is some kind of oral dental care system that you don't have to kind of create something. There is already an example here where you get a pack of floss and brush, paste and a brush replacement, kind of a subscription package, something of that sort. So you can tie up with these companies and kind of give it to your normal clients as well, if they are requiring, if they need it. I know, like, normally uh, they will they can buy directly also, but then you can have some kind of a partnership or collaboration, because that could be something that you can help them to take care of their dental practice. This is one example. Just quickly found it, but you can think of some example where without you attending to the patient, how can you take care of their dental care, any other services, any digital product that you can think of, which is outside of your practice, basically, so that you create a stream of income. I'm not sure if the pricing will match to the amount of money that you make in your business, but this comes under mostly like a passive side of which it doesn't need your attention, and some of your staff member can take care of all the logistics side of this particular service that you can provide to your customer, so patient. So that is one thing. The last thing I think would be like, imagine if you figure out your target patient of influencers, then maybe you can kind of create some uh, talk or presentation which doesn't need to be elaborative. It can be a Steve Jobs style simple presentation on 10 points that could help the people to have a good smile, and research on it, or what are the things that they can do to make it happen, what are the products that are available, explain them what how much time it takes to the procedures, and uh, or simply motivate them for the reason of having a great smile and how it can kind of reduce stress or increase happiness, improves pain tolerance, and beating winter blues. I'm not sure what that is, but basically creating a knowledge product around your experience and how you can uh, increase the life of your tooth, and kind of also help with the help of your smile, how you can help people in their career or business or their individual consultant. So yeah, so that 2 hours you can kind of invest in different ways of uh, uh, creating uh, products or services, and also you can invest it in creating systems. It could be a software system within, so that you can improve the services for your patients, add some reminders and some automated triggers via email or SMS or things of that sort. So you can invest back in your system or your business, and that could help you thrive. The whole idea is there should be a set of stream of income that should be at least 30 to 40% of your annual income that comes without you actually working, and then you can slowly increase the uh, clientele, the ladder of the clientele or the patient, so that you can either increase the membership fees or provide additional services that gives you a leverage of increasing it, so that you can only have few patient and still you can make a north of $1 million or even more. I hope this was useful, some thought, food for thought to ponder. All the best. Bye bye.